Now, the first thing I want to find out, why are you facing this way?
The projector. The projector. They have to bring the projector.
Okay. I thought it's a New Year's time. Happy New Year again.
Same to you,
dear colleagues, dear guests, ladies and gentlemen, first I feel really happy welcoming all of you back, especially the students. The teachers we meet once in a while, so we've had an opportunity of wishing them a wonderful New Year. For the students, I feel really happy seeing you back and seeing you with smiling faces. But you know that it's also a very difficult term. So I want to use this opportunity to request that you tie your belts, especially the final year students, so that we can be able to complete our program and ensure that all of you make it. So this morning we have a special team around. Our classes have been interrupted, but I think it was worth the trouble. If you're not healthy, you will not be able to stay in class. If any person takes ill now, especially with the destructive issues that we have around, illnesses, cancer, AIDS, malaria, and all of that. If any student has that problem now, that student will not be able to study. If a teacher has one of those illnesses, they will not be able to go to class to teach. So we thought it was worth the trouble, sitting here this morning for about 30 minutes, 1 hour, and acquiring knowledge from nothing. Free knowledge. So because Madame Bong, the Vice Principal of the institution, is in charge of health activities and co-curricular activities, I will let her introduce the team to you people. So once more, Happy New Year and welcome back. We want to believe that this year is going to be a wonderful year. Amen. This year is not only going to take care of your academics and other activities, we are also concerned with the health of our students and teachers. This morning we are opportune to have a team of medical experts in the presence of Dr. Ajong Christella, Mrs. Sidoni, Dr. Ajong
This is Mrs. Sidoni.
Mr. Ning Elijah and Dr. Tiga Kuna are yet to come. And we have our young photographer with us. We are opportune to have them talk to us about the different types of cancers. We have all heard about cancer. We have seen people suffering from cancer. We don't know whether some of us seated here are suffering, are experiencing the early age of cancer, or whether it runs through our families. So now that we have the opportunity, let's all sit quiet and listen to them. I'll hand over to Dr. Ning, Dr. Ajong Christella, and the team to talk to us.
Okay.
Thank you, and listen. Okay, before she says anything, Mr. Ning Elijah, who came to inform us yesterday that they would like to be with us today, is here. Welcome, Mr. Ning.
Yes.
Principal, staff, dear colleagues, because I'm a teacher. So, thank you for this opportunity. It's unfortunate that technology has disappointed us, and that's why I'm late. So I'm sorry. We are here on behalf of Celebrities for Africa, as you see on the T-shirt. It's a United States registered NGO. An NGO is a non-profit organization, non-governmental organization that seeks to create awareness on cancer. Because if you put on your TV, you go along the streets, you will hardly see advertisement or something, a message on cancer. Whereas cancer is a deadly and it's a deadly disease and affects so many people. So we are trying to raise that awareness so that you can be able to know what is at stake and then take the necessary preventive measures so as not to catch it. Because as doctor will explain to you, cancer in 99% of the cases is incurable. You can't cure it. And it's painful. It's costly to even follow up treatment. And in Africa, treatment is practically not available in certain parts. So please, we thank you and we wish that you listen attentively to the lecture and become not only ambassadors for cancer to yourself, but you take the message to your family members, your neighbors, and your friends. So thank you for your kind attention, and with your permission, Madam Principal, let Dr. take over.
Sincere gratitude to the principal and the entire staff of this school once again for the opportunity to talk to the whole family of GTTC. So, like we were saying, we started a while ago, we said a cancer is the multiplication of cells, rapid multiplication of cells, which are abnormal in a normal location. So, like I illustrated, if you get to the breast, and cells which are not supposed to be found at the level of the breast are now present, we'll call it a cancer. And those cells have a potential of multiplying faster than the usual cells. That's why the cancers will grow and outweigh the growth of your usual cells, and then they can spread to other parts of the body. Because every part of your body is supplied by blood and by lymph. So that blood and the lymph carries the cells, these abnormal cells, to other parts of the body. That's what we call metastasis. The cells are now located in other parts of the body. So I was asking us which cancers are most frequent around here. And I think I had gotten like 4. We talked of the breast, we talked of the cervix, we talked of the cancer of the lungs, we talked about the prostate, and then I'll add 2 more. So you have cancer of the liver, and you have what they call colorectal cancer. If you notice, cancers are named by where they attack. So colorectal cancers affect the gastrointestinal tract, the intestines. You have the colon and the rectum. So that's colorectal cancers. Those are the 6 most common cancers around here. So we're going to talk about 4 of them basically. I think you have brochures for the 4 of them. We have the prostate, we have the breast, we have that of the cervix, and then we have cancer of the lungs. Let's begin with breast cancers. It affects women mostly, but it's also important to know that breast cancers can occur even in men. They are rare and they occur at a more advanced age, but they can occur in men. Now, breast cancers, there are different risk factors for having breast cancers. A woman who has never given birth in her life is more exposed to breast cancers. A woman who gave birth at a more advanced age, those who give birth late, are more exposed to breast cancers. And a family history of breast cancers, so any first degree related, especially a sister, a mother who has had breast cancer before, is more exposed to breast cancers. And then somebody who has also had a breast cancer before has an increased likelihood of having a breast cancer a second time. Those who have had radiation therapy for treatment of cancers of any kind around the chest, so the breast, the lungs, if you've been treated by rays for cancers, you are more at risk of having breast cancers. And breast cancers could be, they range from asymptomatic, meaning that you don't present with any symptom or sign that will make you suspect it, to some small changes that occur at the level of the breast, which if we are vigilant, we'll notice at a very early stage. And like we said, if you notice cancers earlier, then the better for you, because your treatment options are better. Most of the cancers that we have around here are late-stage cancers, and so we call them end-stage. Because by the time you see the patient presenting with the cancer, it has already spread to other parts of the body, so much so that you can no longer treat it. We only do what we call symptomatic management. If the patient feels pains, you manage the pains. If the patient has some particular problem, you manage it and you accompany them to death, like they will say in literature. But if you notice it early, and you report, the options are better. Now, what are the symptoms that we can have if we have breast cancer? You look at your breast, every lady has the breast. We have two breasts, and there might be a difference at the level of your breast, which should be very small and can be normal. But then when you know your breast and you know how it usually is, then a difference coming, you'll be able to know. For example, you might find a mass, a lump in your breast. If you palpate it, it's a sign of breast cancer. Then your breast can develop some skin changes. For example, there can be dimpling at the level of the skin, and you'll find some small holes like the orange skin. It's a typical presentation of breast cancer. Also, at the level of your nipple, you can have some changes like a retraction. Your nipple goes inside. It's a sign of breast cancer. And then if you express your breast, and there is a secretion coming out from your breast, which can just be colorless, or it can be blood-stained. It's a sign of breast cancer. Now, I understand that sometimes normally your breast should secrete like a breastfeeding mother. But if you're not breastfeeding, and for any reason some liquid comes out of your breast, you need to make it think twice. It might be a sign of breast cancer. So it's not stable. Now, there are also lymph nodes that will form around here at the level of the artery, which could also be a sign of breast cancer. So when you notice any of those changes, what we advise you to do is to seek medical advice. See your doctor to examine, and then he will tell you the next step to take a different ways of reducing breast cancer. If you have a secretion coming from your breast, you could just take that to the lab, look at it under the microscope, and then we'll discover cells. If you have a cancer, there will be some cells there to show that there is a cancer already. Or if you don't have secretion and you have just a mass, they could take out part of that mass. There is what they call a needle aspiration biopsy. They use the needle to pull out part of the cells from that mass, examine, you'll find cells for cancer if it is a cancer. Sometimes we need to take out the whole mass. It's called a precision biopsy. We take it to the pathologist who will examine it. Since there are normal cells which are supposed to be present at the level of the breast, if they are abnormal, then they will know, and then they will know what to do. Now, if you are diagnosed with breast cancer, the different options will depend on how far the cancer has spread. If it is just beginning and is still there, the treatment will just be surgery to take off the mass, take off the lymph nodes around here to prevent the spread, and that will be it. But if it's gone far, you might benefit from what they call radiation therapy. They use X-rays to irradiate your skin to be able to kill the cancer cells. Or there's what they call chemotherapy, which will give you some tablets to go to kill the cells, which are like we said, we don't pray that we should get to that stage of treatment. Prevention is better than cure. Eat healthy. Reduce the amount of fatty foods that you put in your food. Reduce the amount of alcohol that you take, and sensitize others. And when you get to a particular age, especially when you are past menopause already, and when you are about 50 years and on, it's good to screen yourself all the time for breast cancers. And that which you can do, even which you don't need a second party for yourself, is self-examination of your breast. If you do that every month, you can be sure that each time, immediately there is a change at the level of your breast, you will notice it. You can palpate your breast on your own. There are different positions that you can take to palpate your breast. For example, if you stand like I am, or if you are sitting, you could do this. Like they say, standing at a keyboard. You flex your hand like this. You tense the muscles of your breast, and then you can palpate them systematically. If you divide your breast into 4 quadrants, I draw a line like this, and like this. You palpate just like this. If there's a mass inside, you will feel it. And at the end of the exam, you express your breast like you want to take out from it to be sure that nothing is coming out from it. That's the way to examine your breast. If you want to lie down, you can lie down, put your hand on your head, while you take the line position, put your hand on your head, and then you do the same thing. That's how to examine your breast. Okay, I think that's that for breast cancer. Because you have questions that are a lot more detailed than what we are doing. And then there is the cervical cancer. Let me finish with you before we go to them. The cervical cancer is, do we know the cervix? Yes. What is the cervix?
Women.
You know the cervix, but you cannot define it. Why is the cervix found? At the vagina. Okay, I would say after the vagina. Because the vagina is what you find outside. When you go in, you find the cervix before the uterus. So the cervix is between the vagina and the uterus. It's like the gateway, the entrance into the uterus. So women could also have cancers of the cervix, which are very common. Cancers of the cervix, which are very common. And how does it present a cancer of the cervix? Most of it, too, unfortunately, is asymptomatic. But if you have a cancer of the cervix, you could present with abnormal uterine bleeding. Every woman has a cycle, which we understand very well. Now, if you bleed outside your monthly menstrual cycle, it needs to make you think. It might not necessarily be the cancer. It could be a sign of some other thing, but it's also a herald that could be a cancer. So bleeding outside your menstrual period, or bleeding heavier than your usual menstrual period. If, for example, you change 3 pads in a day, and then the next month you change 5 to 6, then there's a problem. There might be a problem. And then also, bleeding for longer periods of time. If you bleed for 3 days every month, next month you bleed for 6 to 7 days, there is a problem. So it's subjective. Every woman has a cycle that pertains to her. So you need to know your cycle, and you know whenever there is a problem. If you have more discharge, vaginal discharge, it will be a sign of cervical cancer. If you have pains around the pelvic region, like lower abdominal pains, it could be a sign of cervical cancer. Like if you have pains during sexual intercourse, it could be a sign of cervical cancer. All of this, like I said, it could be signs of infections, pelvic infections. So if you have such symptoms, it's good to report to the hospital where they will be able to discern between the simple infection and an early onset cancer, where they can be able to help you more. Equally, the risk factors for cervical cancer, you will find the same thing like the family history. You will find the same things like somebody who has not had kids in her life, somebody who has kids at a late period in her life, somebody who drinks a lot of alcohol is also at risk of cervical cancer. So, knowing that there are abnormal symptoms, reporting, and then getting yourself tested for cancers will help you. Now, the good thing about cervical cancers is that we have a form of prevention, because most of cervical cancers that we have are as a result of an infection by a virus we call HPV, human papillomavirus. It's a virus just like HIV, and it's spread by sexual contact for the most part. Smoking can be active or passive. I know when I smoke, it's not just the cigarettes that we sell. Cigarettes, we have the pipe that is smoked by this
No. Yes, these people here are not going to do. Okay.
So encourage those around you not to smoke, avoid smoking yourself. Also, the way you eat will help you prevent some of these cancers, including the cervix. Eat a lot of fruit and vegetables. Give you some vitamins that will help you build the body and will help you fight against cancer. There is also a talk about the use of condoms, but that is still a little bit contradictory because some literature suggests that condoms don't prevent HPV infection, that the HPV virus sometimes can penetrate the uterus. But early stages of cancer of the cervix, sometimes when it's still early, if you use condoms, it prevents semen from getting in contact with your cervix. And semen has some factors, they call prostaglandin, which help those cells of cancers grow faster. So if you use condoms, literature says that you might not prevent the cancer, and that will prevent semen from occurring. And then another thing is the awareness. As we talk to you, you are teachers, you talk a lot, you like educating people around you. You believe that you will carry the message far, and that way many more applicants will benefit from this. And then there is also the screening. Now, people who have been exposed to sexual contact already, within the first 3 years to exposure, we can advise our children to go and do what's called a pap smear to screen for specific cancer of the cervix. It really doesn't take so much time and it's not so invasive. You just take out cells from around the cervix and examine it. So if you do a first pap smear and you don't have the cancer, your doctor will advise you on what frequency to do the pap smear and at what age to stop, depending on when you started doing that. There are other ways of knowing if there is a cancer. I talked about a biopsy in the breast. You can also do a biopsy at the neck of the skin. Take out just a little portion of the cervix and examine to see if you have a cancerous cells. You can also do what they call a cone biopsy. It goes deeper. You take not just the cervix, but the cells even within the cervix. That helps you tell what extent the cancer is already. Is it just localized or started spreading? So, also you can do surgery, and that will be it to tell you whether or not you have cancer. The treatment is the same principle. If it's still early, you can do a radical hysterectomy, means that you take all your and your cervix, so that your cervix is spreading. And especially that's the option for people who want to treat. And it's more secure. You know that even if it has started spreading a little bit, it's not to the rest of the disease. If it has gone too far, like I said, you need to do radiation therapy or chemotherapy. Okay, with that we move to...
Please, I don't know whether all of you are getting what she's saying.
Yes.
Okay, that way you're not getting, are you not getting it? Okay, so is it possible for you to stand here? Okay.
All right, before we move to cancer of the lungs, can we have questions? If you have any questions for breast and cervical cancers.
It is often said that men are weak.
Are you hearing me?
It is often said that men and women who are promiscuous are prone to having cancer, either cervical cancer or prostate cancer. Is that true? That is, you are always using it, and so the cells.
That's an interesting question. I'll answer in two phases. I'll answer for the cervix and then for the prostate. For the cervix, yes. For the cervix, not for the reason she did. Not for the reason she did. But if you are promiscuous, it means that you're exposed to sexually transmitted infections, which include HPV that we just talked about, and which is a pre-lesion for cervical cancer. So promiscuity can be a factor for cervical cancers because it will expose you to HPV infections, which can later on move to cervical cancer. But for the prostate, no. It's true that some people say when you overuse, your sexual organs, you can be, but literature hasn't proven that. Instead, it is said that it could be a preventive factor for prostate cancer. Sexual activity. Some literature says that prevents prostate cancer. But promiscuity, of course, can never be the solution because it will expose you to a lot more problems than you have.
When you say regular, how regular?
Contextual. Maybe twice a week, maybe 4 times a week, with your spouse, please. With your spouse.
Don't produce HPV infections because
What is it?
infections that fall under.
Like I said, HPV is a virus. Human papilloma. Only we have HIV 1 and 2. HPV has different types. We have HPV 6, we have HPV 18, HPV 16. There are quite a number of HPV viruses, but all of them cause an infection called HPV. And the manifestation, if we know warts, vaginal warts, some small growths that come out from the vagina and they come outside, they really look like growths. I don't know if we've seen them sometimes. That's the manifestation of.
Do you have any picture there?
Let me see if we do.
It's really good. I wish that's what they were to project. Yes.
For what? We have
Please, question.
Having cancer without her knowledge. Will the cancer affect the child?
No. No. It will not affect a child. Cancerous cells are not like infections like HIV, which can be spread by breast milk. It will not affect a child.
Volume.
Nobody is hearing.
If the disease is contagious, no. In the same line we have, it's not contagious. A child could only have breast cancer due to genetic factors, but because of breast milk, no, there's no exposure. Contagiosity, no, it's not contagious as well.
Yes, sir.
Yeah, people talked about smoking. I don't know if this normal smoke from the kitchen that's using the fireside or the can easily affect.
No, from the fireside, no. But other elements of air pollution, like burning certain material around, is possible. Air pollution could be a factor, but the kitchen smoke, no.
Yeah, there is a question that way. No, let's.
If you realize that you have a lump around the right-hand side, does it really mean that it's a sign of cancer, or there are lumps that are normal? Because at times they say if you overwork your right hand, you might develop a lump around this area. So I wish to know if all the lumps that are found around the right-hand side, they are sign of cancer.
When you talk about right-hand side, please, are you talking about the breast or you're talking about the armpit?
The breast around
the armpit?
Yes.
Okay. Having a lump there is not necessarily a sign of cancer. Any infection around here will produce a lump here because we have what we call lymph nodes, which drain our system. So if you have an infection around your right chest, you could have a lymph node there, and it's not necessarily a cancer.
From what you have said, you said that talk about cervical cancer. Okay, if a woman have that such unit, can the woman take it? Because I know that cervix helps to hold the child, helps to avoid the woman
It helps to
miscarry.
Okay.
Then can the woman take it?
Yes, the woman can take it. The cancer just means that abnormal cells are multiplying at the level of the cervix. But the cervix still has its function. So the woman can take in because the sperm can still pass to fertilize the egg. It's true that the cervix holds the pregnancy. The problem now is if it is advanced, then the woman might be at risk of a miscarriage because the cervix becomes weak. But the woman can take in.
Just in junction with what you were saying, madam.
Go ahead, please.
If you are affected with one of your testes as a result of cancer, can it be possible that to give birth to a child can it depend on a woman?
If you are affected with one of your testes,
Yes, madam.
can we get the prostate? Thank you.
Okay, last question here, please. Then we'll go. Okay, two last questions. Yes, madam.
Doctor, you talked about prevention. Under prevention, there is nutrition. It's not well understood when they talk of the consumption of papaya. That point is not understood.
Okay, if you eat pawpaw quite often in a week, it could be an added prevention for you with regards to cancer.
Got my pawpaw tree in the house.
So you have pawpaw, and aside from pawpaw, you have vegetables and fruits. All of those will help you stay healthy. And also, since you talked about diet, reduce your fat consumption.
So, Ero, eat it once in a while. But eat more vegetables, fruits. So, last question.
Doctor, is the vaccine meant only for virgins?
We say it's preferable because the vaccine only works when you are not yet exposed to the HPV infection. If they inject you when you already have the infection, it's not going to do anything. So when we privilege virgins, we know that they don't even have a sexual exposure, so they don't have the infection.
So I'm not really clear.
Okay.
You said
David, put off that camera.
wood produce carbon monoxide. A normal petrol or gas that we use produce carbon monoxide. Now, which of the gaseous material that really causes this cancer?
That's why I said the problem is not actually what the gas is, but what material has gone through combustion. So it's the content of the material that is burned and not actually the smoke. That's why even with smoking, it's more of the nicotine than just the smoke.
And just to add to what you say, when we come to lung cancer, you will understand it better. Yeah, last question, please. Let's go to the next country.
If a pregnant woman having a cervical cancer, if the baby is growing fatter, can the baby size reduce stop or reduce the growing of the abnormal cells?
No. If the cells are already multiplying, and like I said, when cancers come, the drain is really independent from the baby growing there. Blood is supplied to and from the cervix. So those cells will follow the blood and the lymph to other parts of the body, whether or not the baby is growing.
Doctor, I wish to find out, it is also said when you buy a new pot and prepare food, the material that comes out from the pot causes cancer. I don't know if it's true.
Aluminium as a factor, as a cancer precursor, not well documented.
The truth is that out there in the West, where this information is really advanced, they don't use those pots. So it is difficult for them to investigate something they don't use. But when you look at the way the pots are manufactured, they are risky. So I don't know how we can avoid it, but cleaning them very well before starting to use them is another added advantage.
Just clean them well, but like I said, literature is not clear.
Well, let's go on to lung cancer.
Yes. And you undergo surgery. Locally, people say that the thing spreads to other parts of the body. I don't know how true that allegation is.
Okay. Usually, if it's a cancer that is still localized, and they take off the whole mass,
yes,
they take off these lymph nodes here to prevent its spread, no. But usually, even if it's already at an advanced stage and they see that spread has been done, surgery is not an option because you increase the spread. That's why some cancers, when you go to the hospital, they refuse to operate them. They might put them on radiation therapy or on chemotherapy, but surgery is not an option. Okay, lung cancer.
That's why if you discover a lump in your breast and the operator can remove it, and after a while you still realize that there is something there.
You go back, because not every lump at the level of the breast is cancerous. There are lumps that we call benign. It means they are simple. Most young girls even have it. It's just what they call a fibroadenoma. So when you go to the hospital, sometimes they open and remove it. Usually those ones can even recur. But what happens is that when it recurs, it's good to report back. And when they remove a mass from your breast in the hospital, ask, even if it's not, the doctor did not plan to do it, ask that they should send it for pathology, so that they can look at the cells that are found there. If it is a simple fibroadenoma or it has some cancerous tissue in it, if it comes back, just go back. You can go in for a biopsy, let them examine it. If it's a simple fibroadenoma, fine. But just go in for screening consultation. There's some masses that are simple.
Doctor, you mentioned the fact that if you have, when you have cervical cancer, sex becomes painful.
Sex can be painful.
Can be painful. I don't know. It like gives us the impression that pains during sex, you start being afraid that it's cancer.
I think I made allusion to the fact that all those symptoms and signs that I have cited don't necessarily mean that you have a cancer. But they could be manifestations of a cancer. So it's better to be sure. Like I said, even simple infections, an inflammation of the vagina, an inflammation of the cervix can cause pains during sexual intercourse. So it could be a simple pain, it could be a pain linked to an inflammation or an infection. It could equally be a pain linked to a cancer. But why not rule out the cancer knowing that it is more dangerous? It could be something simple. But if you have it, and especially if you are not used to having that pain, it should mean something to you.
Radiation is a predisposing factor to cancer. I don't know how effective that is. And even if it is true, why do we recommend people to X-ray and other ultrasound exercises?
Okay. You know, in medicine, almost every procedure, if not every procedure in medicine, is potentially harmful. But when the risk-benefit ratio is weighed and the benefit is more, then we go in for that. And so if we see that you need an X-ray to be able to better manage you, we will go in for an X-ray. That notwithstanding, if you are more exposed to rays, be it for diagnosis like in chest X-rays or for treatment like radiation therapy for other chest tumors, you are at risk for cancers. So it's just that to tell you that if you are exposed to those things, you need to get screened more often than somebody who is not exposed. But sometimes we always need to do those things, either to better manage you or to even diagnose the problem. The best way to differentiate is pathologically, because when you take part of the cells, when you take the cells for examination, you get a precise view of what the cells are, and knowing the normal, you'll be able to tell whether it is benign or malignant. It is said sometimes, for example, a lump in the breast, if it's regular in outline and it's non-tender, usually it is benign. But that does not mean that some malignant cancers can present in that way. So the most secure way to tell whether a mass is malignant or benign is to do pathology.
Please, let's continue. Wait. You want to ask another question on cervical cancer? On
cervical cancer.
Go ahead.
Now, the cervical cancer leads to breast cancer.
Cervical cancer leading to a breast cancer? No. There is metastasis, but the breast is not one of the sites, especially for cervical cancer. Metastasis goes to different parts of the body, and different cancers have particular locations where they metastasize. The breast is not a secondary tunnel for cervical cancer.
Okay.